So coming up, we will ask you to give him a grand round of applause. Dr. Sriram Deivasigamani is a rising star of focal therapy this year. We're really privileged to have him. We presented the email by the email announcing the price, and his answer was, "What did it took it so long?" So, it's completely untrue. He's the most humble guy that I know, I think, and thanks to him, the focal registry is moving forward. Started. He, created the founding of the registry. So we're really glad to have him today to honor his work and listen to his talk on the whole-gland ablation in contemporary practice. What is the role? Thank you, Sriram.
Thank you, Dr. Santasalas. Thanks for those kind words. And I would like to thank the Focal Therapy Society for giving me this opportunity. So today my topic is role of whole-gland ablation in contemporary practice. So to start with, we'll discuss the evaluation of whole-gland ablation. So the first cryotherapy study in whole-gland ablation was published by Dr. Onikan et al. In 1993, which resulted in multiple clinical trials, leading to the endorsement of American Urological Association in 2008 with a white paper. This leads to multiple clinical trials as well as registry studies, and eventually the guidelines accepted as a treatment option, as a legitimate treatment option for low risk and select low risk and intermediate risk prostate cancer patient. And it allows the use of whole gland ablation in select high risk disease, especially in a clinical trial or a registry setting. We did a white paper last year after 14 years of white paper in 2008. And it got published in European Urology, where we came up with the indication of whole gland ablation. It involved international co-authors, experts in whole gland ablation, and said that the whole gland ablation can be used as a legitimate option for low risk, intermediate risk, and can also be used in high risk prostate cancer patients who are not an eligible candidate for radiation therapy or a radical prostatectomy, or even if the patient would like to go for a whole gland ablation rather than a radical approach. This shows the trend over the past 2 decades, comparing the whole gland ablation with focal ablation. This is mainly the comparison of number of publications on whole gland ablation for the prostate cancer compared to the evaluation of the focal ablation. Although the focal ablation and whole gland ablation was started in the same time, like whole gland ablation in 1993 and focal ablation in 1995, so the whole gland ablation took a peak from 2000 to 2010 and resulted in multiple publications from 2015 to 2022. There was the first focal study was published in 1995, resulting in large registry series in 2015 and 2018. This image shows a sharp rise in number of whole gland ablation publication with a fall in publication number from 2022 to 2024 with the evaluation of the focal therapy. This transition is mainly either due to advancement in the energies and interest among the clinicians in the new techniques, and the evolution of focal ablation might be due to better imaging modalities with a comparable oncological and a better functional outcomes, as well as the decline in the whole gland ablation might be due to other confounding variables like the prostate volume, resulting in less therapeutic efficacy. Right now, the whole gland ablation is used either as a primary disease or following a recurrent disease after radiation therapy or after a primary ablation. Currently, it is also used in oligometastatic disease, mainly to decrease the tumor burden. So the same study where we did a consensus statement on the indication, we also did a comprehensive systematic review and meta-analysis on whole gland ablation. We did a thorough comprehensive systematic review from 1996 to 2023, which included 29 studies with a sample size of 4,000 with a median follow-up of 72 months. So we looked into the main clinical outcomes. We also compared the old data with the recent data, where the 10-year biochemical progression-free survival was overall 58%. And we compared the old data with the new data, like from 2000 to 2014, compared to 2014 to 2024. And we found that the recent data has an overall increase in the biochemical progression-free survival compared to the old data, which indicates the advancement in the imaging techniques as well as the improved learning curve while doing the whole-gland ablation. The metastasis-free survival rate at 10 years was 84%, and for cryo it is 93% at 5 years, and for HIFU it is 93% at 5 years. And the cancer-specific survival rate at 10 years was 96%. So coming to the complication, the overall stricture rate was 11%, and the urinary retention in 2014 to 2024 was 6%, which is significantly improved as compared to the old data, which is 10%. The most dreadful complication, the rectourethral fistula after whole-gland ablation, was 0.7%, the overall data. We did a subgroup analysis between 2014 to 2024, and it is 0.1%, which is significant than the old data. Coming to the functional outcomes, the overall continence rate after whole-gland ablation was 96%, and the preserved erectile function was 37%. These are the two recently published studies in 2020, where they compared the patient who underwent a whole-gland ablation for low-risk and intermediate-risk prostate cancer with a radical prostatectomy. And both the studies have shown it's a propensity score matched analysis, where they shown there was no significant difference in the overall survival as well as the biochemical progression-free survival rate. Recently, we are doing a same systematic review and meta-analysis on salvage whole-gland ablation. We use the same keywords as well as the search document for doing this study. This study included 53 studies and with a total of 8,000 patients, near about 8,000 patients. For salvage whole-gland ablation, the biochemical progression-free survival at 10 years was 35%, and the metastasis-free survival at 10 years was 78%, and the cancer-specific survival was 83% at 10 years. Coming to the complications following salvage whole-gland ablation, the rectourethral fistula following salvage whole-gland ablation was 3%, with a confidence interval between 3 to 4, and the overall retention was 13%. Coming to the functional outcomes, the overall continence rate was 77%, as well as the preserved erectile function was 21% following the salvage whole-gland ablation. The new contemporary practice is usage of whole-gland ablation to decrease the tumor burden in a patient who is having oligostatic metastatic prostate cancer. There are two recently published trials where they combined the cryotherapy with the immunotherapy. This is the first trial where they did a whole-gland cryoablation in 12 patients, followed by an adjuvant systemic immunotherapy, pembrolizumab. The median progression-free survival was 14 months, and the median systemic therapy-free survival was 17.5 months. We are waiting for the second phase of this study to determine the long-term outcome. And this is a study where they combine the whole-gland cryotherapy with systemic autologous dendritic cell therapy and the intratumoral immunotherapy. They did this study in 16 patients where they used adjuvant immunotherapy, both systemic as well as intratumoral immunotherapy, and they found that the overall progression-free survival rate was higher in patients who had a combined therapy, and the median survival was 41 months. And those patients who didn't have a progression presented with increased T-cell receptors in their prostate cancer, in the prostate biopsy postoperatively. In conclusion, whole-gland ablation remains an excellent treatment option for multifocal primary and salvage prostate cancer disease. Over the last decade, from 2014 to 2024, its oncological outcomes have proven comparable to other whole-gland therapies, outperforming the older whole-gland ablation data. This is mainly due to the increase in the learning curve, as well as the availability of the imaging modalities, as well as the advancement in the energy modalities. The recent studies show significantly reduced complication rates, which includes rectourethral fistula, which is the most concern for whole-gland ablation, as well as the urethral stricture rate. With the advancement in energy modalities, imaging techniques, and the improved selection, patient selection through genetic markers, whole gland ablation is said to further enhance the cancer control while minimizing the complications. Thank you.
Then thank you again, Sriram. Your trophy will come by mail because it was not allowed in the plane. We apologize for that.